Greetings, everyone. We are the group to design a workshop specifically for cancer patients, and I'm Mackin Long. Since there are enormous type of cancers, therefore we are confining our core focus to adult bone cancer patients. Before walking you through the details, I'll first present you some background information of cancer patients, what's their concerns and needs, so that it builds up a solid foundation for you to follow up with the reasons why we organize such activities in the later part of presentation. Without doubt, demonstration will also be included, so please sit back and enjoy. The target participants would be confined to bone cancer patients in this workshop. Bone cancer is when unusual cells grow out of control in your bone. It can begin in any bony part, but it most commonly affects in the long bone in our body, such as the upper and lower extremities. It's an important concept that the term bone cancer includes both primary cancers and also cancer cells elsewhere developed in the body and metastasis to the bone. For instance, breast cancer that has metastasis to the bone. Now I'll move forward to the physical and mental status of cancer patients. What are they experiencing? In the first place, the physical status of these patients is caused by the signs and symptoms of bone cancer and the treatments that they received as shown in the PPT. The symptoms include bone pain, weakened bone, fatigue with insomnia. Why? Because they can sleep well due to severe bone at night. The side effects of treatment also make patients suffer. For example, in surgery, the amputation might make them experience difficulties in walking and obstacles when performing daily routines. They are most likely feeling extra tired after chemotherapy and radiotherapy. Most significantly, both treatments suppress their immune response so that they are prone to infection. In view of that, when we are brainstorming the activities, we consider their physical status. And when we plan the activities, we act accordingly and strategically. Since the patients would be very painful, bodily contact would be minimized. For instance, massage that requires the application of force onto the skin would not be done. It is expected they feel extremely discomfort if we apply force onto their skin. Also, patients are expected to be less energetic. As a result, activities will be lower workload with more breaks in between. To continue with, when we imagine how the patients would look like, we expected they may have walking difficulties due to surgery done. As a result, our staff will pay extra attention and effort to give them a helping hand to aid in their working and also walking. Apart from that, as mentioned before, patients have weakened bones. In other words, they are prone to fracture. In spite of that, we'll offer more than enough seats for them to reduce their embarrassment of giving up seats to others. At the same time, minimize their time of standing. And floors would also be ensured and examined. It's not slippery because the participants cannot risk of falling off once. Furthermore, the physical status of participants could also be reflected from the treatment side effects I mentioned before. Apart from surgery, chemotherapy and radiotherapy are the major treatment approach. Yet, these two treatments would suppress patients' immune system. Thus, participants are susceptible to viral infection. In light of that, we'd avoid invasive techniques, for instance, acupuncture, would also ensure the activity is clean and sterile. Hand hygiene is also required for all the organizers in order to protect our participants comprehensively. After walking you through the physical status, now it's time to present you the mental status of bone cancer patients. Cyril Miller pointed out more than 30% of our patients are depressed. Such negative feelings are derived from the side effects experienced physically, the sickness and pain. Furthermore, bone metastasis patients are in an advanced stage. Negative thoughts easily reason in their mind. How many days do I left? When will they die? They will feel easily hopeless and loss of interest in something they participated before. They will feel they're useless and powerlessness. Well, in fact, even though primary cancer in reality has a satisfactory cure rate, the patients will still feel anxious because in traditional Chinese culture, cancer is a lethal disease, cannot be cured. It's a taboo. Such thoughts have actually deep-rooted into many elderly's minds. They make patients get anxious and stressed easily. Well, in fact, to cope with that, we, organizer, would be very patient, repeat and explain the instructions gently. Since participants are depressed and also with insomnia, they may have poor concentration and less sensitive to instructions. As a matter of fact, they may feel less motivated in engaging activities. But well, their presence to our workshop already proven they have gone through some mental obstacles and actually they are eager to engage into social activities again. They might just feel shy only. Account of that, we'll adopt a positive and encouraging attitude by saying you did a great job, you are much better today. Hope by saying that could cheer them up and increase their self-esteem. After presenting you the mental and physical status of bone cancer patients and the coping strategies, now I'll pass the time to Yuan Hao Wai, as he will going to brief you some activities in order to solve these or simply elevate these patients' difficulties.
Hello everyone, my name is Yuan Hao Wai. Now I would like to talk about the Activity 1. Activity 1 for the bone cancer patients will be a dietary education in form of lecture, cooking demonstration, and food tasting. It will last for around 1 hour. Since the bone cancer patient will suffer from severe bone pain, it is not suitable to conduct a physical exercise for them. Hence, a dietary lecture will be a better option for them, because a proper dietary strategy is essential to deal with both the primary tumor disease and some side effects from the cancer treatment, especially from the chemotherapy, such as the nausea and vomiting, which may decrease their appetite. However, they should not stop eating, which may decrease their nutritional level. Instead, the patient should learn how to eat properly in order to maintain their body weight and improve their nutritional level to cope with the side effects from different cancer treatment and facilitate the treatment progress as well. For example, the chemotherapy dosage is given according to their body weight, and the body weight is also critical in the immobilization progress from the radiotherapy. Therefore, during the 30 minutes lecture, 3 critical dietary ingredients, including the protein, omega-3 fatty acids, and vitamin, will be introduced. I will illustrate their advantages and what kinds of food enrich those ingredients. For example, we will suggest the patient to absorb more protein from seafood and white meat, such as the chicken. They can also get the omega-3 fatty acids from fish, and the vitamin is rich from different kinds of vegetables. The advantages of protein, including the repairing of damaged body tissue due to the cancer treatment, such as radiotherapy or surgery. It can help to build more muscle in order to maintain a good body weight and providing the body with a good structural framework. Also, a suitable protein intake level can keep their immune system healthier. While omega-3 fatty acids has the advantage to improve bone quality by preventing bone decay and the accumulations for the bone mineralizations. It is good for bone cancer patients since they may suffer from severe bone loss or even the osteoporosis disease, which is kinds of health conditions that weaken the bony structure and make them fragile and more likely to break. Moreover, omega-3 fatty acids also has the anti-inflammatory feature, which will relieve the inflammatory response caused by the tumor expansion or due to the side effects of chemotherapy. While vitamin can control different kinds of body functions, including the hematopoiesis. For example, a side effect for the systemic chemotherapy will be anemia, where the vitamin B6, B12, or vitamin C are associated with the hematopoiesis progress and it can relieve the side effects of anemia. Some study has also shown that a high-dose vitamin C intake level can slow down the tumor growth by inhibiting the tumor angiogenesis. After introducing the advantages of critical ingredients, we will also give them some advice about the proper sequence of eating strategies from before, during, and after the cancer treatment. For example, before the treatment, they can eat high-protein foods and high-calorie foods to boost their nutritional level and body fuel. Just make their body ready to withstand the treatment side effects. During the treatment, they should maintain a proper nutritional status to cope with the acute treatment side effects according to different cancer treatment type. For example, chemotherapy, which is the most common treatment modality for bone cancer patients. The patients should eat more vegetables to absorb more vitamin and avoid any fried or greasy foods, which is hard to digest. For surgery and radiotherapy, they should absorb more protein to repair the damaged tissues. And after the bone cancer treatment, the patient should eat well in order to restore the normal nutritional status. They can eat high fiber food and different kinds of vegetables to absorb different kinds of critical ingredients to restore the normal nutritional level. They can also buy some dietary supplements to help them as well. And for the remaining 30 minutes, we will invite a professional chef to demonstrate how to cook a healthy salmon dish, because salmon is rich of omega-3 fatty acids and protein, which will relieve the inflammatory response during the treatment. The patient can learn how to cook it and taste it from the remaining time. So activity 1 is quite relaxing since they are not suitable for physical activities due to the bone pain. Lecture will be a better option for them. Patients can learn how to eat properly to cope with the side effects of the treatment. It is very important because if they can eat well during the course of cancer treatment, they can suffer less from the side effects and have a better recovery. We will also introduce some dietary supplement in the activity which is suitable for the patients to take after the cancer treatment. Now I will show you a video to demonstrate a simple salmon dish cooking.
Hello, I'm Goka-san. So, the next activity to be organized in our CAM workshop is an aromatherapy taster workshop. So, this activity is mainly consists of two parts. The first part is an introductory lecture of aromatherapy, which is conducted by experienced aromatherapist, and they're going to briefly introduce the basic understanding of aromatherapy and also essential oils. And the second part is exploration journey of essential oils. And this allows all our patients to have their real-time experience of aromatherapy. So the first part of activity lasts for around 15 minutes, while the second part lasts for around 40 minutes, which is split into two sessions and a 5-minute break is in between. So all our participants are welcomed to join in this activity, and they are divided into two small groups of 8 to 10 patients in a group. So the reason for us to organize a taster workshop is because we observe that a majority of bone cancer patients, they're experiencing a variety of physical and psychological complications. For example, most of our patients are suffering from the signs and symptoms from primary disease, like intense bone pain and insomnia, and some of them receive side effects from their radical treatments, and its side effects include nausea and loss of appetite. And due to the prolonged signs and symptoms and also the side effects, the mental complications may also develop, such as anxiety and depression. And therefore, we're seeking a therapy which does not only uh, is effective to alleviate their physical complications, but also it can focus on their psychological status and spiritual status. Therefore, we found that aromatherapy is suitable and should be recommended to our patients, since it can provide a complemental and holistic care so that it can be helpful to improve our patients' quality of life. So, it is essential for our patients to gain their real time experience of aromatherapy, since most of them are new to this treatment. So, instead of boring and exhausting seminar, so we'd like to conduct an interactive taster workshop for them to um, actively share and also gain their uh, real-time experience, get a taste of aromatherapy. So we believe that interactive workshop is more suitable to be conducted. So in the first part of our activity, an aromatherapy lecture is given by experienced aromatherapy as guest speakers. So they are going to provide some basic understanding of these fundamental materials and it is essential oils. So the first thing we're going to mention is the extraction of essential oils. Since, as I've mentioned, that most of our participants may be new to this therapy, so they may have worries or misunderstanding that essential oils may be some artificial substances. So we must clarify this misunderstanding and tell them that the essential oils are extracted naturally from plants so as to reduce their worries about application of essential oils on their skin or being inhaled. And the second things that we have to mention is the properties of essential oils. They are sedative and antiseptic and appetite stimulating. And the last one is relatively important because it affects their nutritional status and also ultimately affect their tumor control. Since it also affects the completion of their treatments. And the third thing to be mentioned is the function and also the mechanisms of essential oils, how they relieve their complications. So hopefully the aromatherapist can explain the mechanisms behind in a simplified way. And also the last thing to be mentioned is the safety precautions. Since essential oils are volatile and concentrated, so we must remind our patients, participants, that to be beware of the aroma dose and frequency of use in order to prevent overloading. So, in the second part of our activity is the aromatherapy exploration. It is also conducted by aromatherapists by and delivered by simple apparatus such as paper tissues and cotton sticks, where essential oils are diffused onto them. And the essential oils are inhaled by our participants, and the essential oils include clary sage, lavender, frankincense, and bergamot. And the aromatherapists are going to walk our participants through the procedures of aromatherapy in details, including diffusion of the essential oils, distributing the um, essential oils which match with their relative complications, and guiding them with the suitable aroma dose and duration for their first trial of aromatherapy, and also try to monitor their breathing patterns and breathing depths in order to gain the optimal results. Also, the patients are encouraged to share their feelings and complications during the exploration journey so that the aromatherapist can hold a discussion and also match the essential oils, which could uh, alleviate their complications. So, inhalation aromatherapy is chosen as the administrative method since it is a quick access method and it can be delivered in just simple apparatus which could be found in home settings. Also, it is a effective access method so that uh, the psychological complications could be effectively relieved in a limited time period. And also, it can avoid to apply direct force on patient's skin, and it actually echoes with the strategies of coping with physical status, as we've mentioned in previous slides. And we should avoid causing pain to patients affected bone cancer site. So for the essential oils chosen, lavender is one of the um, essential oil aroma should be chosen for especially the patients who want to improve their sleeping quality and also who have anxiety feelings. And also for the patients who have depression feelings, clary sage and frankincense should be recommended for them to have a trial on our workshop. And especially for those who want to relieve the side effects such as nausea and loss of appetite. Maybe we can recommend them to try bergamot and peppermint aroma of essential oils.
Now, I would like to introduce you the merits of this activity, the aromatherapy taste workshop. To start with, patient care is important as bone cancer patients are highly painful. All the activities are based on eliminating pain and to avoid physical pressure on them. Therefore, all staff members should provide them a chance to relieve pain in the affected bone cancer site. Through the lecture, the participants can have basic knowledge of different essential oils. They may know the use of essential oils for different symptoms and also how to use them in a safe practice. During the demonstration, the patients can try aromatherapy through inhalation. They can also learn the administrative methods and apparatus required to perform aromatherapy. Other than physiological and mental perspectives, social health of these patients are also taken into consideration. The activity provides a chance for them to meet new friends and to share their feelings. Although there are rare contraindications for aromatherapy, these patients are taught in a workshop to select suitable essential oil as well. In this part, I will perform a demonstration of inhalation aromatherapy. Simply, from its meaning, the essential oil is applied to the patient by breathing in them. Before aromatherapy, we need a comfortable seat. The main point here is to let ourselves calm down. Therefore, you may choose the sofa or even lying down, as long as you feel good. It is recommended to do some deep breaths to help us keep calm. In the workshop, each participant can try 2 types of essential oil from a total of 4, including clary sage, lavender, frankincense, and bergamot. Now you can see the apparatus we need for inhalation aromatherapy. Here are the bottles of different essential oils: clary sage, lavender, frankincense, and bergamot. So we got some tissue papers and some cotton sticks. So let's start. First, we get the clary sage, and we use a cotton stick to soak small amount of essential oil and drop 2 drops onto the tissue paper. So we inhale the oil now. So remember, take deep breaths and breathe slowly. Concentrate on the oil and try to forget your difficulties from the disease. So the therapy lasts 15 minutes. After that, the patient can try another essential oil for another 15 minutes. So here shows the overall workshop scheduling. The 2 activities will last around 2 hours. Activity 1 is the dietary strategies education. It got 30 minutes for the lecture, 20 minutes for cooking demonstration, and lastly 10 minutes for tasting the food with a Q&A section. Activity 2 is the aromatherapy taste workshop. The introductory lecture lasts 15 minutes, with 2 exploratory sessions, each last 15 minutes. On the other hand, you can see many breaks in between. This is because these are the bone cancer patients. They suffer pain and mental problems. Patient care must be considered as they may not have energy to concentrate on the workshop. Resting is therefore required. So, in conclusion, we should not underestimate the pain and psychological difficulties from bone cancer patients. They not only have to encounter the complications brought from the disease itself, but also the treatment side effects. For example, fatigue after radiotherapy and nausea after chemotherapy. To address on them, nutrients are important. The dietary education provides them knowledge in intake adequate nutrients effectively and the way to cook them delicious. On the other hand, aromatherapy allows mainly mental relaxation, which refers directly to pain relieving. Last but not least, we hope that the participants can continue these practices at home and share with others as well. So here are the reference page. And this is the end of our presentation. Thank you.